Hello, it's me again, Amy, the MA mentor. I am here with another video on today. We're talking about infection control. If you really like these videos and they're helping you at all, please like my video and subscribe to it. And I will be adding videos daily, if not weekly, until we can get a good number of the things that you all want to learn more about, have broken down a little bit. If there's anything that you want me to hone in on or describe a little better too, please put that in the comments. And I will definitely get to that. But today we're going to talk about infection control, which is a huge thing that we need to do as deal with as MAs. So no further ado, infection control and safety. So first off, it's really easier to understand how to control infection from spreading when you understand how infection spreads, if that makes any sense at all. So this is the cycle of infection and how it begins, and how it is just very cyclic in how it works. So you've got the first part of this cycle, which is the infectious agent. There has to be an infectious agent in order to have infection. Makes total sense, right? In order for the infectious agent to do anything, there has to be other chains in this cycle. Now, the infectious agent in and of itself is not harmful. And that could be a bacteria, a virus, just it sitting there all by itself, lonely and doing nothing is not a big deal. It's when it finds a reservoir to embed itself in. And a reservoir is usually what we also term as a host. And that can be a person, an animal, an insect. Okay. And once it finds its way into the reservoir, now we're on to something. Now it becomes a problem. Okay. Now, just sitting in the reservoir, again, not a huge deal to the reservoir, but not a huge deal to everyone else, until there is a portal of exit. And that is the next part of the chain. There has to be some way for that infectious agent to leave that reservoir host. And that can be a variety of ways. For humans, it can be sneezing, coughing, touching something. It can be anything. But the exit itself is where that comes from. So does it come from the nose, the mouth, the eyes, possibly? Did it come out of the mouth onto the hands? Okay. Either way, there has to be some way for that infectious agent to leave that host for it to become now a more serious issue. Then just leaving the host isn't usually a huge deal either, because now it goes back to just it being an agent, right? Just hanging out. Now there has to be a mode of transmission. And the mode of transmission can be what I was saying, the sneezing, the coughing, direct transmission. If I onto you, it is going to then possibly, you could breathe it in, whatever the case might be. And that will now be the mode of transmission. Airborne, indirect causes. I could cough into my hand and then slather it all over the tabletop. And then you sit down and you're going to eat your lunch. And you drop something onto that tabletop, pick it up and eat it, 5-second rule. And now that infectious agent has left my body, indirectly transmitted now to your body. However, without a portal of entry into your body, it's not going to go anywhere. So if you touch that tabletop with your hands, as long as you don't like rub your face or anything, that probably will be as far as it goes. Or if you go and immediately wash your hands, that could possibly be as far as it goes. But if your hand has a cut on it, or you do rub your face or touch your eyes, now you've taken that transmitted infectious agent and put it into a portal of entry in you. Now, does everybody who touches things get sick? No. Some people have really good immune systems and it just doesn't happen. So the next chain then is there has to be a susceptible host. And that host has to be either immunocompromised, a little run down, maybe not vaccinated against a certain illness, something like that. And that infectious agent that now entered that portal is going to infect that host. And then guess what? The cycle starts all over again. Okay. So our jobs as healthcare professionals, and why I go through this whole thing, is to make sure that we know how to break that chain. Okay. Keep ourselves healthy. We won't be susceptible that way, or as susceptible possibly. Don't touch things and then rub your face. Make sure you wash your hands constantly. Make sure you cover those coughs and sneezes. Washing the hands is probably the biggest thing, or using hand sanitizer, which we'll talk about here in a minute. But if we can break those chains, we will not have infectious disease running as rampant as it could. And that is what is known as infection control. All right, so means of transmission. We talked about the means and the modes of transmission. Just to be able to differentiate, there is airborne. Airborne's transmitted through the air and inhaled by the new host. And that again could be the sneeze. Bloodborne. Bloodborne pathogens, and pathogens, of course, are anything that can cause a disease, microorganism-wise. This is transmitted through the blood, which is why we do not want to touch blood that is not ours, not understanding if there's any disease being carried through it. We can have foodborne transmission, which is the ingestion of contaminated food or drinks. Vector-borne. Vector-borne transmission is transmitted by a living organism from one host to another. So mosquitoes are a perfect example of that. Mosquito lands on one person, bites them, they have a disease in their blood. The mosquito then transmits that disease to the next person they bite. Direct contact, I had mentioned that occurs through direct skin to skin. I cough in your face and you inhale it, contact. Indirect is what I talked about as far as, rubbing my face and wiping my hand on the table. That occurs through contact with what we call fomites. And fomites are objects. The table, your cell phone, which, by the way, cell phones are nasty, nasty. Those are probably one of the dirtiest things we carry around. But yeah, fomites are any object that a microorganism, a disease-causing microorganism, could land itself on. The various communicable diseases and illnesses that are out there, and these are not all of them, obviously, but the major ones are as follows: varicella, which is chickenpox, viral and bacterial meningitis, rhinovirus, strep throat, pertussis, which is whooping cough, influenza, which comes around once a year, of varying strains, measles, which we are seeing a resurgence of as of the making of this video, and COVID-19, which is still out there. Those are all communicable. They are all illness. They all cause illness. The majority of those are viral, except for the bacterial meningitis. I did not add tuberculosis on there. Tuberculosis is not a huge thing in the US, probably bigger than people think it is. But tuberculosis is a bacterial illness as well. All right, so let's talk about hand hygiene. Okay. Probably one of the biggest defenses we have against disease is just washing our hands. Okay. I don't know why this is so hard for people. We call it aseptic hand washing in the medical field. The method for this is you really are supposed to remove your jewelry, so rings and things like that. I will say this, if you're working in the medical field and you are very hands-on, very clinical, my advice is just don't wear rings or necklaces, bracelets, anything. They just get in the way. And rings especially can hide nastiness underneath them. They can also get in your way when you're trying to wash your hands, when you're using gloves, all of that. So I do have some friends that wear the silicone wedding bands, which is not a bad idea if you really don't want to be without a wedding band. Because those are not as bad and those are easier to remove and get under to wash, but really supposed to take your jewelry off. Turn the faucets on and adjust the water to warm. You don't want it to be hot. You don't want it to be cold. Wet your hands, apply soap. And I know what you're thinking. You're going, oh my God, I've had students in the past do this. I know how to wash my hands. I'm an adult. Yes, I get it, but you would be very surprised at how inefficient people are at washing their hands. Um, so bear with me while I go through this. Not to mention, some of this is on national exams when you take them for as an MA, just so you know. Hint, hint, wink, wink. Work the soap into a lather on all the surfaces of both hands and rub for 2 minutes. Now, different books will tell you different things. 2 minutes is a really long time. They say at least 20 seconds. Or if you've heard this before, if you can sing the happy birthday song through twice. That is probably the best way. Rinse well. Allow the water to fall off the fingertips. So don't do the thing like they do in the movies where they do this. That's a sterile scrub. You want the water to run this way off of your hands. So off of your fingertips. Dry your hands with a clean paper towel and then use that paper towel to turn the faucet off if you have to turn the faucet off. Some offices have the automatic sinks that just come on. Some of them have the one that you push with your knee and it'll come on, so you don't have to worry about that. But if you are going to turn the faucet off, use your paper towel to do it, because it would kind of defeat the purpose if you grab the nasty faucet after you've washed your hands. And I've seen people do it, so just think. We also use the alcohol-based hand sanitizer. It is an alternative to hand washing in a pinch. Nothing substitutes for good old soap and water hand washing. But if we need to, we can use hand sanitizer. The alcohol content needs to be at least 60 to 95% for it to be effective. Most hand sanitizers we see are like 70%-ish or so. This can be used when water and soap are not available. It can be used before and after patient contact. You'll see this in the hospital a lot where they sanitize in and sanitize out of the room. It should not be used when the hands are visibly dirty, so you have visible something on your hands, before and after eating, after using the restroom, or if you suspect that you have come into contact with bacteria. Those are times when soap and water is best. And most of the things you read and see, it will say to, and we all know this, to wash our hands after we use the restroom. Pro tip, wash your hands before you use the bathroom too, if you're working in the healthcare field, because God knows what is on your hands before you go to the bathroom. And you don't want to be touching your body with whatever's on your hands before you go to the bathroom. So just, keep that in mind. OSHA bloodborne pathogen standards. So OSHA, if you are not aware yet, is the Occupational Health and Safety Administration. It is the germ police, as I call them. The safety police, germ police in the medical field, safety police in every other field. If you've had a job in your life, you've dealt with OSHA, whether you knew it or not, directly or indirectly. In the medical field, OSHA has a very specific set of rules that we follow. The bloodborne pathogen standard was set forth in 91, so not that long ago. These are rules on how to handle infectious or potentially infectious waste in the medical field. We have our little biohazard symbol there and sign. You will see that anywhere where biohazard goes or is present, or possibly could be present. But these infectious or potentially infectious wastes can include blood, body fluids, human tissue, cultures, vaccines, any type of paper product like gauze, linen, anything like that that contains body fluids. Sharps, and sharps are basically anything that is or can become sharp if it were to be broken. So needles, obviously, and then things like glass ampules or glass vials. If those were to break, they would become sharp. So those go into sharps. And any used disposable supplies like gloves or cotton swabs, or anything like that. Universal precautions basically helps to prevent healthcare workers from exposing themselves to infectious materials. One of the best kind of rules of thumb for universal precautions is just assume that all materials, blood, body fluids, OPIM, you'll see that a lot. That means other potentially infectious materials, are infected. If you grew up around hunters or anything like that, and you were taught maybe at a young age to handle or at least to understand about firearms, probably had the grandpa that said, always assume a gun is loaded. Well, that's the same concept. Always assume that any type of blood or body fluid or just anybody for that matter is infected with something. And that way you will treat everything the same and you will protect yourself in the same way every single time. This is not to say that we assume everybody's infected to discriminate or anything like that. We just assume everybody's infected, so we do the same thing across the board. Hand washing, obviously. PPE, personal protective equipment. That can be anything from gloves to masks to face shields to eye protection to gowns to booties to bouffants. Okay. Proper disposable of biohazard materials and sharps. Okay. You'll see in the bottom right-hand corner of your screen there, those are sharps containers. Sharps containers are where sharps or potentially sharp objects go because they're rigid and puncture proof. And then of course, proper cleaning materials, or I'm sorry, procedures, proper cleaning procedures. We're not at home just wiping down the kitchen table, okay? There's certain things we have to do in a medical setting to make sure things are clean. Here is just a little visual of what biohazardous materials look like. And these are the non-sharps that would go into a biohazard container or bag like you see up in the upper right-hand corner there. This can be bloody gauze, swabs, bloody gloves. You'll see a couple of reagent strips there. One is for, let's see, that could be a pregnancy test maybe. The other is for urinalysis. Once, by themselves, they are not biohazard, but once they are used for what they are used for, like the urinalysis reagent strip is used to dip into urine, it becomes a biohazard material. Just like the swabs, once they are used to swab whatever it is they are swabbing, they become biohazard material. The urine cup, once it's got urine in it, even if it's dumped out, it still had urine in it. It's biohazard. Okay. Here are what sharps look like. And those are your sharps containers up in the upper right-hand corner there. You have the various needles and syringes, needles for venipuncture, the tubes that you draw blood with. Many of those are plastic nowadays, but there are still some that are glass. And even if they are plastic, if they break, they become sharp. Ampules, glass ampules that contain medicine, glass vials that contain medicine. Once they are empty, they need to be disposed of in a sharps container because if they break, they will become sharp. We talked about medical or aseptic technique. Medical asepsis is just basically what we call a clean technique. This is when we make sure we hand wash, use our gloves, clean equipment, sanitize surfaces, as opposed to sterile asepsis, which is any time or anything that is going to require, say, procedurally wise, a sterile technique. This is sterilizing all the equipment and instruments, usually done in an autoclave that sterilizes by steam, 250 plus degree Fahrenheit steam kills pretty much everything. And that can be instruments, sometimes supplies. I know when we would run out of sterile gauze, we would just package some gauze and throw it in the autoclave and suddenly it was sterile. You use sterile gloves. You do, as the person in the center there is doing, a sterile scrub. The sterile scrub is like hand washing on steroids, where you wash all the way up to almost your elbows using that little spongy, brushy thing you see in the corner there. And this is done anytime there is a sterile technique required. So when is a sterile technique required? Any procedure that would require penetration of the skin or tissue. If a provider is going to say drain a cyst, they are going to use a scalpel to cut open that cyst. That scalpel needs to be sterile. Everything around it needs to be sterile. Anything touching it needs to be sterile. Okay, so that is when you employ this sterile technique. Personal protective equipment. There's several things there. We've got gloves, masks, eye protection or goggles, booties for the feet, for the shoes, gown. That's yellow is usually isolation. A bouffant, which is like a hairnet, basically. And then you also have my personal favorite, so you don't have to wear two things, the mask and face shield that are connected to one another. You just throw that on and you got both. One kind of close to last thing I will discuss here is the safety data sheets. This is an OSHA requirement. A safety data sheet is basically a sheet, and you can get these right direct from the manufacturers, that provides quick access and information about all the chemicals that are in your office. And by chemicals, I mean anything that is chemical, right down to your hand sanitizer. You have to have a safety data sheet. They used to call them material safety data sheets. So you'll still see some people call them MSDSs. They dropped to the M not too long ago, and now it's just SDS. Either way, it's the same thing. But it will have all of the information as far as what the product is, the various chemicals that are contained within the product, the supplier information, what to do in the event of an exposure to that chemical. Do you call somebody? Is it like a poison control situation? What can it cause? Can it cause skin irritation if it gets on your skin? Should you be rushed directly to a hospital? It has all of that information, and those are to be made available to everyone that works in the office. In the event of an exposure, somebody can go to that, find out what's going on and how to handle it. Each office also should have an exposure control plan or an ECP. An ECP is basically a plan depending upon your various facilities, that talks about what is available for safety, what to do in the event of a safety breach, so to speak, or an accident. These are updated annually, so they have to be updated at least once a year, or if a procedure changes. Okay. These for the medical field really include things like engineering controls, or what they call safety devices. These are the little sheaths that go over needles to protect people from getting stuck accidentally. Um, PPE, what is available, what is recommended, what is needed. The fact that you, and especially in the medical field, a provider or an employer is supposed to be able to provide or offer hepatitis B vaccinations to all of their employees. What type of post-exposure follow-up is required? What types of labels and signs do we have? What information and training is there for the employees, and have the employees been trained, and when will they be trained if they haven't been? And then documentation of all of that training. Because if OSHA comes in and you don't have something like this, your facility can be fined, and that's not fun at all. So really need to keep up on this stuff. All right, so that is it for this video today. Again, if these help you out and you want to see more, please like and subscribe to the channel, and I will see you next time.